This is what to do if you suspect that a patient has pheochromocytoma. The first thing to do is your basic screen. You screen with plasma-free metanephrines or do a 24-hour urine collection and measure catecholamines and metanephrines. That's your initial test for a pheo. If those are normal, you can recheck them during a spell. If they're high, and that's defined as 2 to 3 times the upper limit of normal, you can go ahead and do a CT scan of the abdomen or an MRI of the abdomen. If the CT or MRI of the abdomen is negative, there are other imaging tests you could do for a pheochromocytoma. You can do an MIBG scan. This is a molecule that resembles norepinephrine, and you could see where it's taken up in the body, if it's taken up by adrenergic tissue. You can also do an octreotide scan, a whole body MRI, or a PET scan. In the background here is a PET scan, and you can see accumulation around the adrenal glands in the middle here. If the CT MRI of the abdomen is positive, you can go ahead and do a surgical evaluation for removal. You might also do genetic testing to see if the patient has any of those familial syndromes that predispose to pheochromocytoma, and you definitely want to do alpha and beta blockade before the surgery. If the tumor is particularly large, if it's greater than 5 centimeters, you also want to do an MIBG scan if you suspect that there's extra adrenal disease.